Let's turn our attention next to talking about prevention. And the key here is understanding what we mean by the different types of prevention, because prevention is not one thing, it's several different things. We're talking about primary, secondary, and tertiary prevention, and you need to be clear about the distinctions being made here. Primary prevention. In primary prevention, we are stopping people from ever getting the disease in the first place. In primary prevention, people simply never acquire the disease. We're able to intervene so they don't get it. That's nice. Primary prevention, then, can be thought about as simply preventing incidents, stopping the onset of disease. Secondary prevention, by contrast, we're finding a problem and we're fixing a problem. In secondary prevention, people have the disease. What we're able to do is intervene so they no longer have the disease. A simple way to think about secondary prevention, then, is preventing prevalence. Getting people that had the disease so they no longer have it means our prevalence goes down. Tertiary prevention, by contrast to both of the previous, now someone has a disease or a health problem, and we can't eliminate the health problem. What we can do is make it easier for them to live with this problem. We're going to increase their options, increase their flexibility, increase their ability to live and move in the world around them. In other words, tertiary prevention is about quality of life. Do those again. Primary prevention, preventing incidents. Secondary prevention, preventing prevalence. Tertiary prevention is about quality of life. Let's make sure you understand what's happening by giving a few simple examples here. When I wear a seatbelt when I drive my car, that's primary prevention. Should I get into an accident, I won't hurt myself nearly as much. When I wear a yellow hard hat when I go on a construction site, that's primary prevention. Someone drops a brick on my head, I won't crack my skull. When I wear a condom when I have sex, that's primary prevention, stopping the disease from ever taking place. Secondary prevention. Well, screening, by definition, is about secondary prevention. Because when we do a screening test, we're finding who has the disease, so we can then intervene to try to get rid of the disease. Screening, therefore, is not, get this, about primary prevention, it's about secondary prevention. Within the medical community of the United States, we do not really do a very good job of primary prevention. We do a very good job with secondary prevention. We're used to screening, finding a disease, and then treating to get rid of the disease, secondary prevention. Tertiary prevention. Our hospitals are called tertiary care centers, and for a reason. When you go into the hospital, we do not expect you to be, quote, cured. We expect you to, well, become more functional, become more able to deal with the world with your disease in place. A patient that has diabetes, our intervention is going to be tertiary prevention. They will always have diabetes, given our current understanding, but we will be able to make them more functional, be able to live their life, be able to have a longer life because of the intervention that we put in place. Now, usually these concepts are fairly straightforward once you understand what we're talking about, but there are some issues that are a little slippery, and you're going to have to focus on what exactly the exam question is talking to you about. Let's talk, for example, about the issue of getting a patient to quit smoking. Patient smokes cigarettes, I get them to quit. Is that primary, secondary, or tertiary? Well, the answer is it depends. If you see cigarette smoking and addiction as the core problem, when I intervene and get them to stop smoking, that's now secondary prevention. They had the problem, now they don't have the problem. On the other hand, if you see smoking as a risk factor for heart disease, for lung cancer, well, then getting them to stop smoking is primary prevention. How do you know which you should consider it, primary or secondary prevention? The question will target you as to what you should focus on. If they target you of just getting rid of smoking itself, secondary prevention. If they target you to getting rid of smoking to reduce the chance of heart disease, that's clearly primary prevention. Hypertension is another example in the same vein. If you see being hypertensive as in itself a disease, then getting screening, detecting hypertension, and getting the patient to do things to reduce their hypertension is, of course, secondary prevention. If you see, on the other hand, hypertension is a risk factor for cardiovascular disease, for cerebrovascular accidents, well then, detecting, treating, and eliminating hypertension is primary prevention for stopping those cerebrovascular accidents and the heart disease. The issue here is one of terminology and you paying careful attention to what they're focusing you on the exam. Once again, Primary prevention, preventing incidents. People never get the disease in the first place because of what we've been able to do. Secondary prevention, preventing prevalence. We screen, we detect, we treat, it goes away, people don't have it anymore. And finally, tertiary prevention. It's about quality of life. We'd find a problem, we treat, we can't get rid of the problem, but we can make people more functional, more able to enjoy their lives, and if we're lucky, we give them more longevity going forward.